Very morning, doctors. A very good morning. So, welcome to our final session of physiology. I think it took so many days for me to complete this, but no issues. We'll complete this as fast as we can. This is the final session of physiology. We will complete it today, right? So, today we will discuss something about special senses. Very important topic. You will be getting no less than 2 MCQs from this topic, at least from the physiology, as well as you might get an integrated question with anatomy as well as the medicine, right? So please be steady, right? Concentrate here. Okay, so special senses. In special senses, what are the main special senses that every person on this planet have, right? If you ask me the main special senses, we'll just take it like vision, auditory, that is hearing, taste, and all sort of SSS, that is somatosensory system. Now in this we will discuss something about the vision clearly. Okay, so we will discuss about the special sense, that is vision, right? Now coming to the vision, so we can divide the whole pathway and the members and all the participants that takes place in this pathway into 3 components. One is the receptors of the pathway, another one is the pathway itself, and final one is the centers, the cortical centers, where the whole of the image is processed, the cortical centers. Now what are the receptors present in visual component? That is rods for vision in dark light, that is darkness, and cones for vision in bright light. Okay, now the pathway is defined as a optic pathway. We will discuss this optic pathway exclusively in the ophthalmology. And the cortical centers are area number 17, 18, 19 of occipital lobe, and the color vision exclusively significant to the V4 area. Remember, this is very important. But this one, area number 17, 18, 19 of the occipital lobes are for visual pathway. Okay. Now if a person is in the darkness, if the person is in the dark environment, right, what happens? The rhodopsin, it's actually vitamin A, show 11 cis retinaldehyde plus opsin chain. So you have 2 components, that is the rhodopsin consists of 11 cis retinaldehyde plus opsin chain, right? And during the lightness, for the vision in bright light, what happens is the all trans retinaldehyde, it leads to closure of sodium channel by transducin, that is, wait, I'll write it clearly, by transducin, that is G protein, right? Now this produces, what happens is, this actually produces hyperpolarization and all other receptors produce depolarization. You understand or not? See here, what happens is the trans-retinaldehyde, it leads to the closure of sodium channels, right? It leads to the closure of sodium channels by transducin, that is G protein. It's a G protein. Now what happens is this leads to hyperpolarization of the all other receptors. Hyperpolarization. This leads to hyperpolarization, whereas while all other receptors, they produce depolarization. Understood? So what we can deduce from this statement, that only rods and cones produce hyperpolarization. Hyperpolarization. Now coming to the next system, that is auditory system, that is hearing. Auditory system. Coming to the auditory system, what are the main cells that are important for a auditory system? The first one is inner hair cells at organ of cortex. At organ of cortex, where it is present in cochlea. How many coils are present in a cochlea? 2.5 turns. Remember, 2.5 turns, right? So inner hair cells of at organ of cortex present in the cochlea. Now what actually the other stage, the potassium is actually high in endolymph of scala media. These are very important stock points. Please check this one, revise these points as crystal clear light, right? Now what happens is the potassium channels when open, they leads to cochlear microphonic potential production, CMP, that is cochlear microphonic potential production. So in turn we have one more pathway, that is auditory pathway. Defined as colima. Very important. Okay, colima. So the auditory cortex is present in area number 41 and 42. And if you ask me, the superior temporal gyrus, that is area number 22, is actually the vernix area for language. Okay. Now auditory cortex is actually 41 and 42. Remember this, very important, short. Now what is the area for memory? Anyone? What is the area for memory? Anyone please tell? That is angular gyrus area. Angular gyrus area, and the area number is area number 39. That is for the memory. Which memory? Word memory. For word memory. Okay. Now coming to the next senses, that is taste. See, all the points are stock points. Please remember, they are all stock points. Now what are the structures on the tongue that detect the taste? The papilla. Different types of papilla. There are actually 3 to 4 different types of papilla. So we will discuss here. The first one is the fungiform papilla. It is present at the tip of the tongue. And the second one is foliate papilla. It is present at the bilateral sides of the tongue. And the third one is circumvallate papilla. It is actually present in a disc-like structure. That's why it's got a denoted name, that is circumvallate papilla. It is present at the back of tongue and it's very essential for the detection of bitter taste. Okay. Now if you ask me for the salty taste, the ions that are responsible is sodium or the potassium. And if you ask me for the sour taste, that is denoted by proton or acidic components. And if you ask me for the sweet, that goes for G protein couple receptor with the help of cyclic KMP. Right. Now finally for the bitter taste, it is mostly given by it helps in binding poison. No. లేదు. So it helps in binding poisons like cyanide, so that you can our mind can detect like it's actually a substance which is very damage to the body. Right. Now there is one more taste. Most of the times we don't discuss about it, but there is one more taste, that is umami. What is this umami? It is actually denoted with MSG, monosodium gluconate, or some other substances like Ajinomoto. See, it's a spice. It's actually a type of powder that we uses in our day-to-day dishes, right? Ajinomoto. Then meat also gives umami taste, etc. Okay. Most of the people, is chili a taste or not? Chili is actually not a taste. It's actually a site of pain sensation. It's a type of pain. It's not a taste. Chili is not a taste because chili consists of a compound called capsaicin. Okay, which bind to vanillinoid receptors. Sorry, it's not vanillinoid, it's vanilloid. Sorry, which binds to vanilloid receptors. It's VR or TRPV4 type of receptor. Okay, so that is why you get that chili, that sensations you get. Chili is actually not a taste. It's actually a pain sensation that our tongue detects due to presence of a capsaicin. It binds to the vanilloid receptor, VR, or you can also denote it like TRPV4. Okay. Now coming to the final sense, that is SSS, that is somatosensory system. It is actually, these are the sensations, these are the actual sensations from body, like pain. You just take it like pain, temperature, touch, everything, touch, etc. All these sort of things, they come under these type of sensations. Now what are the receptors in SSS? What are the receptors in somatosensory system? The receptors are, these are very important, guys. You will get images regarding this one. First ones are Merkel disc, right? First ones are Merkel disc. These are actually present in the epidermis. These are actually present in the epidermis, and they are useful for the detection of sustained touch and pressure. That is, you can discriminate the 2-point discrimination. You can define the 2-point discrimination, and it's actually best at the fingertips. Okay, how much? Can you tell me what is the differential gap between those points? That is 1 to 2 m. You can detect up to this much of distance. Even 1 mm of distance between 2 points can be detected with the help of this Merkel's disc type of receptor. Now, this feature is the actual cause which helps the blind people to read the Braille script. That is the reason how the blind people can read the Braille script. Why? Because these two-point discrimination feature that these Merkel's disc receptor possess, that you can, with the help of these two-point discrimination feature, you can just detect even 1 millimeter of distance between 2 points. So that is the reason the blind people can read the Braille script. That is the reason. Okay. Now, one more type of receptor, that is Meissner's corpuscles. See, these are stock points, doctors. Just you need to revise these points and go to exam. That's it. For NEET PG I am telling, but for INICET it is again a different scenario. Okay. These Meissner's corpuscles are actually present at the tip of dermal papillae. But what is their use? Their use is they actually detect fine touch and also low frequency vibrations. They can also detect low frequency vibrations. Now another type of receptors are Pacinian corpuscles. Right. So what are actually these Pacinian corpuscles? They are actually onion shaped receptors which are present in the deep dermis. Right. And they detect the high frequency vibrations and pressure. And one more type of receptors are the Ruffini's endings. These are actually helpful for the detection of warmth like feeling. Okay. Now with this we have some other special type of receptors. They are also very much useful. The cross end bulbs, very important for INICET. This one, the cross end bulbs, these are actually for the cold and sustained pressure like conditions can be detected. Sustained pressure can be detected with the help of cross end bulbs. See, you don't get these type of direct statements. You will get a question like, the examiner will describe a scenario and the examiner will ask, the person is able to understand this so and so because due to the functioning of. So he will ask like that. The person will ask like that. So only if you know the actual concept only you can answer the question. Elsewhere you will obviously make a wrong statement, right? And another type of receptors are the free nerve endings. See, these are normal things. Free nerve endings. These are actually for the detection of pain, temperature, itching, and mainly sexual sensations. Very important. With sexual sensations, they also detect pain, temperature, and also itching. Itching sensation is also detected by these free nerve endings. Itching. Very important. Okay. So with that, we'll just drop this, and we will discuss something about the pain. So we have fast pain and slow pain, right? So actually, what is fast pain? So it's actually detected by A delta, right? So just 1 minute. I think you know what's the symbol of delta, right? So the fast pain is detected by A delta myelinated nerve fiber. Myelinated nerve fiber. So for example, what are the examples? Something like if there is a skin injury, and if it is a somatic superficial pain, or if it is a sharp and well localized pain, can be detected as a fast pain by A delta myelinated fibers. And coming to the slow pain, it is conducted by C unmyelinated autonomic nerve fibers, right? So it detected in angina, colic, headache, deep visceral pain, dull and diffuse pain. So it's actually denoted like a radiation as well as referred pain. See, referred pain most commonly seen in, can anyone? Hypertension. The pain is radiated from the where? From apex to left shoulder blade or posterior subscapular region. That's a radiation pain, right? Now coming to the tracts, see, this one is very important, the difference between slow pain, fast pain, and which fibers conduct which type of pain. This is very important. A delta myelinated conduct fast pain, and C unmyelinated nerve fibers conduct slow pain. So see, this is the reason, the unmyelination, as the C fibers are unmyelinated, so obviously the impulse will travel all along the axon, so it will take a long time, whereas in case of a myelinated nerve fiber, the impulse will be traveling like jumping from at the nodes of Ranvier, so the impulse time will be short and fast. So that is why A delta myelinated fibers conduct fast pain and C unmyelinated fibers conduct slow pain. Now, can you think like, sir, just because it is slow, is it that much important for the body? Of course, it is very important for the body, because see, not all pains are instantly that should be, instantly you could go for the action. No, not like that. Some pain, some sensations that you should take time to understand why it is coming, how it is coming, why the hell it is actually arising from that particular region. So even slow pain is also important for the body. Don't think like, sir, we have fast pain, no, so obviously fast pain is enough so that we can have a good time. No, slow pain is also important for the body. Okay, so we'll go to the next topic. So the tracts, all the tracts which are important. First one is ascending sensory tract in spinal cord. Present in which? Grey matter or white matter? White matter. Present in white matter. So what are the tracts? The first one is dorsal column. So it is helpful in the conduction of fine touch, pressure, vibration, proprioception. As well as they are also helpful for the detection of stereognosis, graphesthesia, etc. Second one is lateral spinothalamic tract. Lateral spinothalamic tract. They are helpful for the conduction of pain and temperature. spinothalamic tract, that is STT, right? Now anterior spinothalamic tract, anterior spinothalamic tract. Guys, you can understand my writing now, please. Okay, anterior spinothalamic tract. It is helpful. It helps in the conduction of sensations related to itching and crude touch, or you can also define it with pressure, crude touch or pressure. Now you take a post central gyrus, which is actually a sensory cortex of a sensory cortex, where the primary areas that define them, are 3, 1, 2. If you ask me regarding the secondary areas which define them are 5, 7. Okay, so you heard about a person called homunculus, right? You heard about a person called homunculus. In your textbook also you will have this figure, homunculus. Actually it is not important for the exam, but sometimes they might ask you some questions, which regions of a homunculus, which parts of the homunculus are represented in the maximum area regarding the sensory system or sensory area. So if you ask me that question, I will write down in a single statement, the maximum area in sensory homunculus is covered by which one? Which parts is covered by? Anyone? Sensory homunculus is covered by anyone? Face, in which? Lips. Then comes hands, mainly thumb. These two regions. So that is why actually the thumb has the most proximity. The thumb has the most proximity and the superior thing when compared to all the regions in the body, because it is represented with a maximum area in the sensory homunculus. So that's why we will give a big thumbs up. We will give big thumbs up. Okay, big thumbs up to all my students. Okay, I have given a big thumbs up. Okay. Now we will go on to the next component, that is the motor area. The motor area. So coming to the motor area, or the it's not area, it's cortex, the motor cortex. So coming to the motor cortex, the area 4, 6 has bed cells. Very important, guys, the bed cells. So UMN, that is upper motor neuron. These are segments of UMN which give corticospinal or pyramidal tract. Now the corticospinal tract, they will be having more than 85 to 90% of the fibers. They actually cross at lower end of medulla. Remember this, very important. Lower end of medulla. Okay, lower end of medulla. Okay, now just 1 minute. So actually When you ask me, sir, what is the importance of pyramidal tract, that is PD, pyramidal tract, they actually help in fine skilled movements, right? They actually help in detection of fine skilled movements. They process these things, right? Volume or fine skilled movements. What is the pyramidal tract? They stimulate motor neuron in, actually stimulate the motor neuron in anterior horn. Anterior horn means alpha motor neuron and alpha motor neuron. Anterior horn means alpha motor neuron are lower motor neurons. That is it. Simple. Alpha motor neurons are lower motor neurons, right? The neurons in, so actually pyramidal tract stimulate the motor neuron in anterior horn of the spinal cord. Spinal cord. The alpha motor neuron gives motor nerve, which release which neurotransmitter, everyone, which release acetylcholinate NMG. Understand or not? Understood or not, right? So that is the concept behind it. Okay. Now, what does the upper motor neuron do? It actually controls the lower motor neuron via which tracts? Via which tracts? Anyone? Pyramidal tract and extrapyramidal tract. Okay, pyramidal tract and extrapyramidal tract. For example, if there is a tract lesion, say something like the lesion is at either at pyramidal tract or extrapyramidal tract. It's a UMN lesion, that is upper motor neuron lesion. What happens? Then there will be an occurrence of spastic paralysis. Spastic paralysis. That means the patient exhibits with high tone and reflex. Okay, there will be a high resistance from the patient itself. Now, what does the element, that is lower motor neuron, do? They actually control the muscle by motor nerve. And if there is a tract lesion, that is the element lesion, it's not tract. If there is a lower motor neuron lesion, right here, if there is a lower motor neuron lesion, what happens? It leads to causage of flaccid paralysis. I think now you understand the concept, right? So actually lower motor neuron controls the motor, it controls the motor segment of the respective muscle. It controls the muscle by motor nerve. For example, if there is a lower motor neuron lesion, then it leads to flaccid paralysis. Whereas if there is an upper motor neuron lesion, it leads to spastic paralysis. Okay? Okay or not? Okay or not? Everyone? Okay. Now coming to the muscle. Okay. Now coming to the muscle, the length of the muscle is actually sensed and regulated by muscle spindle. It's actually regulated by muscle spindle. Always remember. Now the tension in the muscle, it's actually regulated by Golgi tendon organ. Golgi tendon organ. Okay, now also it will be a inverse stretch reflex. That's the inverse stretch reflex. Now you take a muscle spindle, that is MS, you take a muscle spindle. So what are the reflexes that it goes on with? That is it defines with stretch reflex or deep tendon reflexes. Deep tendon reflexes. For example, you see a knee jerk, right? You have ever done a knee jerk in a first year of your medicine. You heard of this test, knee jerk test, right? You do in your physiology first year. So this is actually mediated by this muscle spindle with the help of stretch reflex or deep tendon reflexes mechanism, right? What happens is, if there is an increase in length which is sensed by muscle spindle, then what it does, it stimulates alpha motor neuron to cause contraction. Then contraction leads to decrease in length, which brings the muscle back to normal. That is the mechanism which brings the muscle back to normal. Now you come to one more thing, that is gamma motor neuron. Gamma motor neuron. Gamma motor neuron. What it actually does? It actually causes the muscle tone. So what happens? There will be a continuous muscle contractions. Now what does the basal ganglia does regarding these conditions? The basal ganglia, it's simple, it just helps in planning of movement. And what about the cerebellum? The cerebellum, it simply coordinates and correction of movement. And if there is a lesion here, it leads to anyone. What is that condition? Condition called? Ataxia. If there is a lesion in this region, it leads to ataxia. Right? Now, have you ever thought of how the emotions are actually produced? The emotions of a person, they are actually produced by the limbic system. Actually processed by the limbic system present in the temporal lobe. What they do is, they simply help in controlling of emotions, cognition. That is thinking. That is done by frontal lobe. Okay. Now we will discuss something about hypothalamic nuclei. Guys, this is a guarantee question in NEET PG itself. So please concentrate here. NEET PG. Okay. Here we will discuss. Here we will write the nuclei name, and here we will write the major hormones or their function. Okay. So coming to the first nuclei, that is supraoptic nuclei. Coming to the first nuclei, that is supraoptic nuclei, they help in the osmoregulation with the help of antidiuretic hormone, that is also called vasopressin. Antidiuretic hormone is released from posterior pituitary, and from posterior pituitary, what is another hormone that we see? That is oxytocin, helps in contraction of uterus for the expulsion of fetus. Okay. Now they also help in the regulation of uterine contractions. We already discussed uterine contractions, as well as milk ejection. Done by which hormone? Anyone? Oxytocin. Milk ejection. Oxytocin. Okay. Present at the paraventricular region. Present at the paraventricular region. Guys, you know na, regulation of uterine contraction and milk ejection. You know which hormone? I think you know that. Okay, I will write here oxytocin. Oxytocin secreted from posterior part of the pituitary. How does the oxytocin produce? What is the relation with milk ejection? What is the relation between oxytocin and milk ejection? See, I will just discuss in short. See, this is breast, right? For example, if a baby starts to suck the nipple of a mother, so what happened? Then the impulse goes to brain. The impulse goes to the brain. Then from brain, what will happen? From brain, it will release two hormones. Prolactin from anterior pituitary, oxytocin from posterior pituitary. Now this prolactin, it goes, what it does? It acts on the breast. In breast, where it will act? It will act on the breast lacrimal glands. Sorry, alveoli. So you can also call it. See, not the alveoli in lungs. So we can also call the breast glandular tissue in the breast glandular tissue. We can also call the glands as alveoli, but not the alveoli in lungs. Don't they? You see, the lung also has alveoli, but these are different. Okay, these secrete milk. So when these breast glands are initiated by the prolactin, then it leads to production of milk. Production of milk only, not ejection of milk. Production of milk is done by prolactin. So that's why prolactin, production of milk. That's why prolactin. Then what does oxytocin do? Oxytocin, see, there are some cells present in the glands of breast, small cells. They are actually myoepithelial cells. So these myoepithelial cells are small muscle fibers. So when this oxytocin go and act on these myoepithelial cells, it leads to ejection of milk. So these are the functions of oxytocin and prolactin. That is production of milk done by prolactin, and oxytocin does the ejection of milk. Okay, this is all about milk ejection reflex. Very, very important. Even for second year MBBS students also, this is very important. Okay. Now, what is another nuclei? That is paraventricular nuclei. Paraventricular nuclei. Now what does it do? Same, it also does the osmoregulation with the help of antidiuretic hormone, as well as it helps in the regulation of thyroid function. Regulation of thyroid with what hormone? With thyroid releasing hormone, TRH. And one more thing is, they also regulate the adrenocortical function, and help in regulation of sympathetic nervous system, okay, and mainly adrenal medulla. Adrenal cortex secretes corticosteroids and adrenal medulla secretes catecholamines. Okay, very important, please remember, catecholamines. Okay, adrenal medulla. And also they also regulate the paraventricular nuclei also regulate the appetite with the help of corticotropin releasing hormone, CRH, corticotropin releasing hormone. Now very important nuclei, that is suprachiasmatic nuclei. Guys, very important, this nuclei is very important, please underline, suprachiasmatic nuclei. Now what does this suprachiasmatic nuclei does? It helps in regulation of circadian rhythms, very important, regulation of circadian rhythms, right, circadian rhythms, and also pineal function. What does pineal gland secretes? Melatonin. What does the melatonin do? It helps in regulation of circadian or biological rhythms, right? So that is all about suprachiasmatic. Now coming to the next nuclei, that is arcuate nuclei. Arcuate nuclei, they help in stimulation of growth hormone, and also they help in the regulation of pituitary gonadotropins, like follicular stimulating hormone and luteinizing hormone. Okay, and they also regulate the dopamine functions. Arcuate nuclei also regulate the dopamine functions, while actually the dopamine functions as the prolactin inhibiting hormone. Remember, prolactin inhibiting hormone. Remember the D2 analogs. What are the D2 analogs? Bromocriptine. Where do we give bromocriptine? It is the anti-galactopoietic hormone. So we will prescribe bromocriptine in prolactinoma. If it is actually a small tumor only, but if there are major changes in the MRI, then you should go for neurological resection. But if it is a small tumor and there is a minor changes with minor symptoms, then you can go for bromocriptine. If not bromocriptine, you can go for cabergoline. It's given 0.25 BD per week, whereas it is given I think 1.5 or 2.5 mg. 1.5 mg daily. Okay, so dopamine helps in the inhibition of prolactin hormone function. Okay, now what are its other functions? It also helps in arcuate nuclei. It also helps in inhibition of growth hormone releasing hormone, GHRH, growth hormone releasing hormone, and obviously there will be a regulation of appetite also by arcuate nuclei. Appetite. This is all about arcuate nuclei. Now this one again very important nuclei, the periventricular nuclei. The periventricular nuclei. So what about the periventricular nuclei? They just regulate or inhibit the inhibition of growth hormone releasing hormone. Now coming to one more nuclei, that is ventromedial nuclei. The ventromedial nuclei, they helps in the stimulation of growth hormone as well inhibition of growth hormone releasing hormone, as well they functions as a satiety center, help in a functioning as a satiety center, regulated by which hormones? Leptin and alpha melanocytic stimulating hormone. Okay, now we'll go to the next nuclei, that is, wait 1 minute, I'll go to the next nuclei, that is dorsomedial nuclei. Dorsomedial nuclei. They actually help in the presentation of a focal point of information, which actually helps in processing involved in the feeding, drinking, as well as body weight regulation, mainly body weight regulation and circadian activity. Remember, body weight regulation and circadian activity. Please 1 minute, guys. Okay, all nonsense messages coming, right? Nonsense messages. See, don't go for loans in your life, any point of time. Never ever take a loan until or unless it is very important or emergency. And even that loan also, you just check it like the total loan amount. It should be something like at least, or it should be not more than 3 times your salary. That loan amount should be always less than 3 times your salary. That's, for example, your salary is 40,000, let's something like 40,000. If you want to take a loan, go maximum of 1.5 to 2 lakhs. That's it. Don't go loan beyond this sum. It will always trouble you. Always trouble you. So always take loan maximum of this much only. These days I am speaking. See, previous days people used to take 5 lakhs, 10 lakhs, not an issue. But these days, these loan people who are giving us loans, they actually harass you. Luckily, I never got a situation like taking a loan, because I am getting okay like salary to live myself. No, not even I don't even think about loans. So leave about it. Okay. Now the next nucleus is lateral hypothalamus. Lateral hypothalamus. So lateral hypothalamus, it actually simply functions as the hunger center. Now what are the compounds or hormones required for this? That is orexin, ghrelin, and one more thing is neuropeptide Y. Neuropeptide. These 3 components are very important for the regulation of hunger. They increase the hunger, appetite. Now one more nuclei is preoptic area. Preoptic area. It helps in regulation of thermoregulation, plays a good role in thermoregulation. And main important thing, I will write with red color, they help in the regulation of thirst. Thirst regulation, and also they induce the sleep, and also regulating the male sexual behavior. Male sexual behavior. Male sexual behavior. Okay? Okay or not? Now we finally came to the two most important nuclei. Very important, please listen carefully. Anterior hypothalamus and posterior hypothalamus. Guys, very important, these two are. Please listen. You will get a question for sure in the NEET, in the INICT only. So please listen to this. Okay. So what does the anterior hypothalamus function? Why? So it helps in the process of thermoregulation, also denoted as the cooling center. Okay. Now one more process it does is regulation of thirst. Okay. And posterior hypothalamus, it helps in the thermoregulation, and it is denoted like heating center. Posterior thalamus, it is denoted as heating center. Okay. And the thermoregulatory center, that it has the receptors which are capable of detecting the temperature. This is important, underline. It has the receptors which has the capacity to detect the temperature of the blood flowing through brain. That is the cerebral circulation flowing through brain. Okay. So that is the reason we go through all these conditions called skin vasoconstriction, piloerection. Piloerection means erection of the hair present on the skin, and you will get some special states, that is shivering. When you are in a hyperpyrexia state or pyrexia state, you will get shivering, right? And you will have shivering which is actually absent in case of newborns, whereas if it's a non-shivering present in thermogenesis. Why? Because there is a presence of brown fat which lyses to produce the heat energy, whereas brown fat is actually absent in adults. So that is why we shiver when we get fever, because it is absent in adults. So when we get fever, we get shivers, whereas in newborns they have brown fat, that's why they have non-shivering condition. Okay, like now the final topic of the day and the final topic of physiology. With this we finished all the important topics, that is EEG. We will end with EEG, electroencephalograph. It is the recordings that are taken during the sleep, which are used to study the sleep patterns. Okay. Now just 1 minute, I got a call. 1 minute. Okay, back to the class. So this EEG. So actually, if the patient is, or if the person is awake, right? So you will have, wait, I will draw with the thicker one. You will have a graph like, see, it's better I should do with show the image itself, it would be better. Okay, no problem. So you will have continuous frequency of amplitudes of waves, right? You have a continuous frequency of waves, right? For example, the thing you have to remember here is, if the eyes are open, then you will observe beta waves, which are actually having a frequency of 14 to 30 Hertz. Whereas if the eyes are closed, you see alpha waves, whose frequency is 8 to 13 Hz. Now for example, the person goes to stage 1 of sleep. Stage 1 of sleep, that is NRE. Wait, I'll write neatly. I'll write clearly. NREM sleep. NREM means non-rapid eye movement sleep. So how will it be? It's actually a light sleep, and it will be like, wait, I'll show you. It's like a small pincer. It's a small pincer like. So you will have this type of pattern. You will have a light sleep, and here the type of waves that you see is theta waves. In NREM stage 1 type of sleep, you see theta waves which are 4 to 7 Hz. See, these frequencies are very important. Please remember this frequency. Very important. Now coming to stage 2. Stage 2, that is NREM theta. NREM theta. You see here sleep spindles and K complexes. Guys, this phase is very important. This is star mark I am keeping here, and in this you will see sleep spindles as well as sleep complexes. So it will be like, so this is a sleep spindle, see. So this one is actually a sleep spindle, and what you see here is light sleep. Obviously this is a light sleep, and this is actually the longest phase of sleep. Longest phase of sleep. Now there is one more stage, that is stage 3, which is NREM delta, non-rapid eye movement delta phase. Right? What sort of changes you see here? Obviously there will be small crepitations, that's for sure. So actually you will see here a continuous long elongated high amplitude crepitations. That is what you see. You see this segment. You see this segment. It's completely different from a spindle. So it is actually a deep sleep. It's not a normal sleep. It's actually a deep sleep. Right? It's a deep sleep, and here you see delta waves. See, the name itself denotes. You see delta waves, right? You see delta waves, and its frequency is something like 0 to 3 Hz. And this is the phase of sleep where you see night terrors. You feel in this phase of sleep, when you are in deep sleep only, you get night terrors. Then children, they do bed wetting, sorry, not watering, bed wetting, right? And even some of the people has a habit of doing sleepwalking, which is called as, or which is termed as, what is that name? Anyone? Somnambulism. Again I am repeating, somnambulism, sleepwalking, insomnia, sleeplessness, somnolence, hypersleep. Okay na? Okay. Now the final stage of sleep we will discuss, that is REM sleep, that is rapid eye movement. Okay, rapid eye movement. So you will see sawtooth like appearance. So this is actually a little bit hard to remember, but please remember these images. I will give images. See, we have a separate sessions for image. Don't get panicked, right? I will have a separate session for image for you. Okay, so simply remember the REM phase of sleep have sawtooth appearance of curves. You will have beta waves, and you also feel here nightmares, right? And very fearful dreams are felt in this phase of sleep. Fearful dreams. Okay, and sometimes you also undergone with sleep paralysis. The patient feels the sleep paralysis, right? Now, so with this we finish the physiology. So all the important topics, all the sessions I have covered all the important topics, but mostly I don't think like all, at least mostly I have covered it. So if you have any doubts, please drop it down in the comment section. If you have any doubts, if you have any topics that are being left, if you think like that, you please write it down in the comment section. I will bring those topics in the next class. Until then, thank you. We will meet in the next class. Your wise doctor. Thank you. Thank you.